Welcome to News West 9's West Texas View with Johnny Lou Avery.
I'm so glad to welcome you today because we're going to talk about a real serious subject. We're going to be talking about mental health, the facts right here in the Permian Basin in West Texas, but we're also going to be talking about hope for these and the needs for these people who are families who are touched by mental illness. And we are very fortunate to have as our guest Heather McKenzie, who is a mental health advocate for this area. And she's going to give you just a ton of information. And almost all of us have our lives touched in some way by family or friends who have some form of mental illness. So this is a program that almost all of us really need to know more facts about. And Heather, thank you so much for taking the time to join us out of your busy schedule. But before we get into the facts about mental health, I want you to talk a little bit about you and how you got to this work.
Well, I am a mother of 4. My oldest son has severe mental illness, and that is how I was thrown into this area of advocacy. And I've been working with Dr. Jane at Texas Tech,
who is a
psychiatrist, and he's fabulous. And the need in this area is just overwhelming. The impact that mental illness has on so many different facets of our community, our families, and then those that are suffering with this chronic debilitating brain disease.
And one of the things you told me earlier is that 62% of all the people in jails today are there because of mental illness.
Yes.
Not because...
Jails have become the new institutions. So in the 1960s, they had a large movement where they deinstitutionalized. They went in and they said these institutions are harmful to the mentally ill and we need to get rid of them. We want to get the mentally ill back into the community.
Mainstream.
And mainstream everyone. But they
And
failed.
It sounds good.
It does. It sounds wonderful, but it has failed. It's failed horribly. We do have some great community programs. They're very difficult to find, and they help mainly those who have a higher level of capacity. They're not the ones that are extremely
They're more
ill.
functioning.
They're more functioning mentally ill. And the most severe mentally ill, the most vulnerable, are the ones that are just swept basically under the rug. They're left out on the streets, are homeless. A huge majority are severely mentally ill. And your choices when you find out you have a family member with a severe mental illness, as it stands today, you have 3 choices. You're either going to find your loved one in the morgue because they're going to commit suicide or someone is going to murder them. They're going to be in jail. That's going to be the new institution of hope for them. Or they're going to be homeless on the streets. And that, to me, is unacceptable. And we can do better. There are programs out there that have done fantastic work, and we need to implement those programs. We need every community to step up and look at what works, and let's get that implemented in our area. And
so one of your jobs as a mental health advocate, talk about what an advocate is and does.
Well, an advocate is someone who sees a need and they have a voice and they try to get the community to organize and get together and let's figure out a solution.
And you're fighting for those mental health
absolutely
victims, but you're also fighting for their families that don't know what to do.
Absolutely. Most families, when they start digging through this nightmare, they oftentimes just give up. They don't know what else to do. They have to just walk away. And then that leaves their vulnerable, sick loved one basically with no one, nothing. They're just left out in the cold.
Plus, the family then feels guilt. They feel shame. They feel heartache. All of these things.
Yes, and it really doesn't need to be that way. We need to step up as a community, and we need to have programs in place. We need to have support. We need to have knowledge, information. We need to work together as a community to make a difference. And it can be done. If we look at San Antonio, they have what they call a restoration center. And they implemented this. A gentleman who was working with basically MH&MR started this program. He saw the need and he started this program. And what he has done is he has saved San Antonio $50 million in the last 10 years by implementing this into their community. And what
because he's saving on jail space, he's saving on police.
Absolutely.
Going around and landing.
He's saving on ER expenses. I will tell you, with my son, when he becomes ill, what they deem crisis, they deem this as a crisis mode. He's generally in psychosis, where he is seeing things, hearing things that no one else can see. His thoughts are very disorganized. He is very confused. And what happens is I have to take him to the emergency room. He sits in the emergency room for 10 to 12 hours. We normally have to call in a mental health deputy who also sits there. And then we take them to a hospital that is out of town. They hold him for 3 days and then release him.
We just scratched the surface of what we need to hear about that story. We're going to take a break and we'll be right back in just a minute.
Stay tuned. West Texas View will be right back.